Hello and welcome to the Doctor Training Module number 3, Visit Documentation. You'll notice on your overview page that you'll be provided with your today's visits. Today's visits will be an abridged version of your daily schedule. This section gives you the time, length, and status of the patient's visit. The unfinished past visits will allow you to quickly browse through past visits that are requiring additional information or simply just to be finished by the provider. Let's take a look at the patient EHR. When looking at the patient's card, you will be able to see the last and next visit most recently scheduled. A little further below, we will find visits. Clicking on this will open up the visit overview page. The visit timeline allows the ability to access past, present, and future visits. Looking closer at the visit timeline, you will see that you have a filter list by. This gives you the option to filter the list by visits, custom events, and cancel or no-show visits. At the top right, we will have the options of adding a new visit or adding a custom event. Custom events can be created for many reasons. If a patient has a medical encounter during their outside scheduled visit, you can create a custom event. When creating the custom event, you will have the option of adding an event title, event type, and event description. With event description, it is a free text field with the option of adding templates as well as adding attachments. Once the custom event creation has been completed, be sure to click Save. When looking at a custom event or a visit, you will have the provider that it was created for, the type of visit, the category of visit, as well as reason and diagnosis, the date and time of the visit, and then the status. The status of a visit can vary between pending, started, or finished. A pending visit is a visit that has been created but has not yet begun documentation. With a status of pending, you have the option of clicking on the pencil icon to the right of the visit and editing the visit, documenting, canceling, or selecting as a no-show. You also can go to visit billing, go to visit superbill, or go to appointment history, which is an audit log of each appointment. A visit with the status of started means that documentation within the visit has begun. Once this has begun, we will not be able to cancel or edit the visit. We will only have the option of documenting the visit, going to visit superbill or billing, as well as appointment history. If a visit has been started by accident, it will need to be finished and have an addendum added. Addendums can only be added to visits within a finished status. For a visit with a finished status, you will see that no pencil icon appears on the right-hand side of it. This is because the only option that you have for this particular visit is to open it and add an addendum at the bottom. Opening up the visit, we will see that at the left-hand side, we still have the patient's card, as well as options to access demographics, amendment requests, and other features within the EHR. The middle of the screen will be the visit documentation page. You'll have reason for visit, chief complaint, HPI, or a history of present illness, and ROS, review of symptoms. Further down, we'll also have physical exam or vitals, additional notes, assessment and plan, as well as care plans, notes to patient, private notes, messages, and attachments. Before we start going through each section, let's take a look at the top of the screen. We'll see that we'll have the date, as well as the time of the appointment. If we click on this, we will also have the appointment, the type of visit, and the duration. We'll have the provider as well as practice location and any billing information. At the top right-hand side, we will have a finish icon that we will go over a bit later. We will also have a full screen mode. Click on this button and it'll open up your visit documentation in full screen, removing any information that was previously there on the left-hand side, including the patient card. Once in full screen mode, the patient card has not actually been deleted, but more minimized. If you click on the patient's name, you'll be able to have access to full information as well as patient's date of birth, age, gender, last and next visit information, as well as insurance. To the top right, you will still have the date and time of the appointments, and you'll still have all the options on the top right-hand side of the page, including exiting full screen mode back into standard mode by clicking on the two arrows facing each other. The next 3 buttons in the series are going to be for your EHR summary. You'll have the option of maximizing, minimizing, or completely hiding the summary. This also works in full screen mode. And next you'll have the menu icon. From within the menu icon, you'll have options to document using a past visit template, editing the time, expanding or collapsing all sections, sharing or unsharing all sections, exporting all orders, exporting clinical summary, go to visit billing, go to visit superbill, cancel visit, or no-show. Let's take a look at past visit templates. This allows a current visit to be populated with notes from a patient's past visit. This is a convenient feature to have if a patient suffers from chronic conditions. Edit time allows the visit time and date. Edit time allows the visit time and date to be adjusted if for any reason it was not started when originally scheduled. Expand or collapse all sections works exactly as described. It allows you to expand and collapse all sections within the visit documentation in a timely manner. The share or unshare all sections allows all sections within the visit to be shared or unshared with the patient via the Portal Connect platform. It is important to note that reason for visit as well as notes to patients will always be shared within the Portal Connect feature. Looking now at the visit documentation, reason for visit is automatically filled with the information provided at the visit creation. Chief complaint, history of present illness or HPI, and review of symptoms ROS are free text fields with the option of adding templates. You can find the templates by clicking on the blue template icon located at the top right of the documentation square. Be sure to check off any clinical quality measure checklist items that are applicable. You can fill in your physical exam or vitals here. You can add the weight in metric or imperial, as well as height, and temperature can be sent in Celsius and Fahrenheit. When putting in the weight and height, the BMI will automatically be calculated for you. You could add any additional notes here in this free text box or use a template. Looking now at the assessment and plan section, you do have the ability to add multiple care plans by clicking on the Add Care Plan button. To delete a care plan that is no longer needed, simply hover your mouse over the care plan and select the Delete Care Plan button. Confirmation will be required, but once that is completed, the care plan will be removed from the visit documentation. The intentions of the care plan instructions free text field is to give instructions to a patient for this particular care plan. Should text be typed within this field, but the care plan not be shared, a notification will go off asking you to share the information with the patient. When the visit documentation contains more than one care plan, you can choose which care plan to share with a patient. When filling in the diagnosis, clicking in the box will open up patient's diagnosis, which will be diagnosis codes previously used in the patient's chart. This list of previously used patient's diagnosis will allow you to document with more accuracy. To bring up different diagnosis codes within the system, simply type in codes or names. Procedures can be filled in by selecting from the list which is created within the admin settings, or adding a procedure. When filling in a new procedure, you can add the code, any modifiers, and the status. For status options, you have done, which is done in office, plans for future care plan, or historical, which is a procedure that may have been done in the past and is just being added to the EHR summary. Next, you will have assessment and plans, which are both free text fields with the options of using a template. I will show you how to order medications, orders, and labs in a different module. To add an immunization, click on Add Immunization. This will open up an immunization box. You can add a status of administered, planned, historical, or not administered. Should the vaccine not be administered, you can also select a reason why. Should it be refusal, historical immunity, or vaccine contraindication? If the vaccine should be refused, you can also choose to select whether it has been by other, parental decision, patient decision, or religious exemption. Once all required fields have been filled, press Save. Patients will always have access to their notes to patients or clinical instructions. This is also a free text field with the option of using a template. Private notes are strictly for office viewing only. They are not an official part of the patient's EHR or visit. Any messages received and linked to a visit will be found here in the Messages section. And you can also add attachments. You may notice that there is no Save button on the visit documentation page. This is because when documenting a visit, information automatically saves once you leave a section or within 30 seconds into documenting in that particular section. Another great feature is to know that multiple users can document in the same visit at the same time. However, they cannot document in the same section at the same time. When another user is documenting in a section, you will see the section as read-only, and the current documenter's name will show up in the top right of the box. Please note that the number of current users in a visit will also be listed at the top of the visit note. This is especially helpful when you are ready to finish your visits. You will want to wait until all documenters are out of the visit before you finish. Finishing a visit while still being documented by another staff or provider will result in all information typed after the closure to go unsaved in the patient's visits. Something else to note is that HTML browser-based features can be used, such as spell check and finding a keyword or phrase in the visit documentation. Once your visit documentation has been completed, you will now be ready to bill the visits. Clicking on the menu button, you can go to Visit Billing. Go to Visit Billing is for patient billing and charging the patients directly. To start charging the patient, you can add an appointment fee, as well as add custom items or select from the supplies. You can also change your default supply list by clicking here. When adding a custom item, you can add items such as vaccines, flu shots, tests, store items, or other procedures that will be billed to the patient. When selecting through your supplies list, you will be able to select multiple items by checking off the boxes you wish to have added to the invoice. Should you have an extensive list of supplies, you can also complete a refined search for items in your supplies list. Adding a custom item to your supplies list is easy. Simply type in the name of the item, as well as the price, and then click the plus sign. This can also be completed from within your administrative settings. Now that all items and supplies have been added to the invoice, you will now be able to collect payment. It is important to remember that when using cash or check, this feature is for the office to note how the payment was received and is for office records only. If wanting to use a credit card, please note that within Hello Health we do have a feature called Credit Card on File, which allows the practice to bill patients credit cards directly. Reimbursement to the office is either weekly or monthly, depending on the amount. If using a super bill for insurance or third-party billing, you will need to click on the menu button within the visit documentation and click Go to Visit Superbill. Diagnosis codes are auto-populated from the visit documentation and can be added on from the Superbill page via Add Diagnosis. CPT codes and modifiers will also be auto-filled from the visit and can be added on from the Add Procedure or Select From list. The Select From list frequently used procedures will be updated as you continue to use the system or by updating the default Superbill list from the admin section. When adding the CPT codes, you will also need to select the units, the place of service, as well as put a charge for each code. When all diagnosis codes, CPT codes, and remarks have been added, you will now be able to click Save. Saving a superbill cannot be undone. However, you can add a new superbill by selecting the Add New Superbill. This will auto-populate all the information from the original superbill created in the visit. You can also choose to reset to default. Selecting this will have the superbill return to its default settings, which can be adjusted in the Default Superbill section. Once the superbill has been saved, you can now click on the date and time to open the superbill in a new browser. This will allow you to export it or print it to provide to patient or send to biller. This now concludes Module 2, Visit Documentation. Please join us for the rest of the videos in this training series. Thank you.